Welcome to Al-Majlis podcast by Emirates Hospitals Group. Our goal at Al-Majlis podcast is to update you with the latest advancements in medicine in order to improve health and well-being. My name is Dr. 𝗚𝗶𝗶𝘀 𝗪𝗀. I am a consultant pediatrician at Emirates Specialty Hospital, and I'm the host of Al-Majlis podcast. Today, we're going to speak about a very interesting topic, which is joint pain and how to treat it. For this, my guest is Dr. Goran Bicanic. Dr. Goran, welcome to Al-Majlis podcast.
Thank you for having me. I'm Dr. Goran. I'm orthopedic surgeon, originally from Croatia, educated in Europe, Croatia, Germany, Austria, and a little bit in Canada. 20 years of experience, 9 years in Dubai, specialized in the lower limb arthroplasty and the sports medicine. Published already 40 papers in international journals, 15 chapters in books. And today we are going to talk a little bit about joint pain.
Yes. Where is your current practice at the moment?
So I'm available at Emirates Hospital, Jumeirah.
Okay, great to know. So as you said, we're going to speak about joint pain, and we are hearing a lot about injections. So we want to know more. If someone has a pain in the shoulder, in the knee, how can you treat them with the injections?
So we don't start with injection. There are several different options before we start the treatment with the injection. So the first thing is, if the patient is not for the surgical treatment, we look what are the non-surgical options for this patient. So for example, I would start after examination and after we establish the diagnosis and the patient has some tendonitis of the shoulder or some swelling of the knee or the pain in the knee when they do the exercises in the gym. Usually as a first non-surgical treatment would be actually education, because our patients are our partners in the treatment. So they need to understand what is the reason behind the pain. If this is some kind of a wrong exercises or the too much exercises, and most of the problems of the knee and the shoulder are related to the what we call overuse. So you are doing too much squats, or you are doing something in the gym or while practicing yoga. So you need to understand how to do it properly, or whether you are doing it too much, or you should stop doing some squats or the kneeling at all. This is usually the first step.
This is great.
Yes. I think it's very important.
Education. So education is the first step.
Yeah. So it's important to know what are you fighting against. Then if this fails or if this is not enough, most commonly we would go with the pharmacological treatment, which includes tablets. Okay, so in orthopedic surgery, joint pain, mostly it's non-steroid anti-inflammatories like Brufen, Voltaren, Arcoxia, whatever you use, and sometimes we also add a little bit of muscle relaxants depending on the pathology. Now, this treatment, we cannot continue for a long time. Why? Because there are possibility for some side effects. Usually with the anti-inflammatories, it's a lot of gastrointestinal problems, stomach pain, or it can increase the chances for the heart issues. So I would say a week or two of the anti-inflammatory or the pharmacological treatment is usually sufficient to see whether you are going to have some improvement or not. Okay, so you already have two possibilities for the non-surgical treatment.
Yes.
Now, depends. In some patients, on top of that, we also start with the physiotherapy, mostly kinesiotherapy, so the how to do the movement or what are the options in this area. And then the fourth step will be
the
injections.
Okay.
Yes.
So that's great. Education, medical treatment like medications, and then physiotherapy, and last will be the injections. So the patient usually when he goes through the let's say the medications, is there a big percentage that they improve or no? What's the?
Well, it depends. Yes, I would say yes. It depends when they come. Okay, so it's not the same if the patient comes immediately after they start having a problem, because then this is acute tendonitis or something that is happening within the last 1 week, 2 weeks, 3 weeks, and so on. And depends if they had an injury, mechanical problem, or this is not related to any injury. So if you come early, there is a good chance that we can solve it with the rest, education, medication, and maybe a little bit of physiotherapy. In percentages, it's difficult to say because, joint pain, it's not only one thing. There can be 1,000 different things.
and
But
there's
I would say
factors.
that if you come early, yes,
Can have
there is
some
like a
result.
50% chance that just a simple measure, 1 week of medication, rest, ice pack will solve the problem. Okay, but if the patient has something that is more like a chronic, you suddenly discover, oh, I have a pain in the shoulder for the last 6 months, then usually the medication are not so successful.
All right.
No.
So the decision came to go for the treatment with injections. What type of injections we have? What do you inject in that joint?
So I would say there are like 3 main groups of injections that we do. I'll start from the one that is probably the last. So this is like a cortisone injection, because cortisone is the longest on the market. I mean, this is from the beginning, and
Yes.
this was at one point 15, 20 years ago, the only solution for every patient from 5 years
Yes.
to 95 years. Okay, so the
True.
cortisone injections are like a golden standard in the treatment of the pain of the bone and joint
Joints.
and muscles problem. Now they have some advantages and disadvantages, but this is one main group recognized by all the insurances, and they will always push for the cortisone injections.
Yes.
Now in the recent 20 years, we are also doing a lot of hyaluronic acid injections. So hyaluronic acid is nothing else but a gel kind of structure. We would say it for the patient, it's like an oil injection, and it really looks like a high viscosity gel which you put inside the joint. It helps with the gliding, it reduces the friction. We would say it's like a changing an oil in your car.
in the joint.
Okay, so this would be like a second type of the injection. And the last or the first one would be a PRP. PRP, which stands for a platelet-rich plasma. We would call it either a PRP or the plasma. This is when you take the blood from the patient, spin it in the centrifuge, and then separate the cell, the white cells and the red cells, and you just take the good thing from your blood and put it in your joint or your tendon.
Yes, we are hearing a lot about PRP lately. So, but how do you choose for your patients which type of injection? Steroid or PRP or the hyaluronic acid? Based on what? And is there like specific joints they need steroids, other joint can benefit more from PRP? Or based on the condition?
So it's based on the condition and the joint, so it's not easy to choose, okay? I would say that there is no single solution for each patient. So you need to do a little bit of investigation. You don't usually give the injection just when the patient comes and they say, I want injection, or you just say, I want to give you the injection. There has to be some scientific proof behind it. So normally what we usually do during the investigation, we do during the examination of the patient, we do a little bit of investigation. So most commonly you do basic x-ray, sometimes the ultrasound, but before the injection in most of the patient you would do an MRI. Why you would do an MRI? Because you can really see inside the joint or around the tendon what is the problem. In general, I would say like this: if the reason for the pain is inflammation and there is a lot of liquid inside the joint, you have a swollen knee, you need something that will work more as anti-inflammatory.
Yes.
Then I would go for a plasma, or I would go for a PRP or cortisone injection. Now, based on the age and other factors. If, for example, there is not so much of inflammation in the knee, and that you have a young lady, 25 years of age, doing a lot of gym, no inflammation, but still suffer from the pain, I would go for the hyaluronic acid for a lubrication. The other indication is also the joint. So the hyaluronic acid would be exclusively for the joint. You don't give it into the tendons. It's much better for the joint, for example, for the knee, almost exclusively, because rarely you will see a patient with a shoulder joint problem. In the shoulder, you will always see 99% of the cases the patient has a problem with the tendon itself. And when it's a tendon or the muscle, then the PRP is much better option.
Yes, it's tailored based on the need and
Exactly.
joint and joint condition also. Yeah. So how much time these injections need to start to be effective after you do it to the patient? How long does it take the patient to feel the difference and to feel some results?
That's not an easy answer, and it's a difficult question. But in general, I would say like this. Once you do the injection, the effect is usually visible within the first week of applying the injection. Sometimes after 1 to 2 days. So, for example, if you have a calcific tendonitis of the shoulder, the injection works from the next day. Okay, so the patient see the difference next day. For the knee, usually it takes 3-4 days, but I would say that most patients have, if they are going to respond to the treatment with the PRP, hyaluronic, or the cortisone, they should see some effect within the first week, okay, mostly 3 to 5 days, but first week, sometimes up to 2 weeks. If within the first 10 to 14 days you don't see any improvement, it's not working.
Then it didn't work for them. But good to know. And how long this effect, if it works, how long this effect will last with the patient?
So this is another typical question that the patient asks.
Yes.
It's difficult to answer this. It depends. Again, I would say, let's say cortisone injection. If it's a simple cortisone injection and you just need one, usually couple of months, okay? Whether 3 months, 6 months, it's difficult to say, because if you have someone with a severe advanced osteoarthritis and a lot of inflammation or rheumatoid arthritis, they would need to come a little bit more often, okay? One shot, then it can be also like a permanent solution. With the PRP also, if it works, and it usually we give it for a mild tendonitis or mild inflammation, then it can be just one shot and done. Okay,
that's the goal.
Yeah, that's the goal. But sometimes you need to repeat it. We usually repeat it. Let's say the PRP, I would repeat it like in specific cases, like once a week for 2-3 injections, or once a month for 2-3 injections. But I would say plasma will work its magic in the month from the application. Hyaluronic acid and the cortisone, they will work for a couple of months, 3 to 6 months. But there are patients that are happy with just one injection, and for 2-3 years you don't see that.
That's great. That's great. And is it an easy procedure? It's an injection in the joint.
So depends who you ask. For me, it's an easy procedure. For patients,
so
not
the hands
always.
of the expert, it's always safe and easy procedure.
It's not always safe and easy.
Okay, because it's a joint,
so I would say like this: knee injection should be easy, both for the patient and for the surgeon who is applying. So I can almost, or the orthopedic surgeons can almost guarantee that the knee injection will not be painful. Okay, so you give a little bit of local anesthetic. It's usually a couple of minute procedure. You give a local anesthetic in the joint, you inject, and that's it. Okay. For the shoulder, it can be a little bit more painful. Why? Because it's a little bit a trickier area, more wider area, so you need to give a local anesthetic in different places. So for the shoulder can be a little bit more uncomfortable. Usually not to that extent that it would require like sedation or like a day procedure, although occasionally we do it for someone who is very, very much afraid of the needles. But most of the patients tolerate it very well, and it's a short procedure. You come to the clinic, we do it, and you go home.
And the complications are less? We don't have?
So the complications are very rare, okay?
That's good. That's reassuring.
So
yes.
It is, but not zero, okay? There is no procedure
Nothing
in medicine then there is zero. So when we say very rare, it's 1 in 3,000 chance for infection. So, when it penetrates with the needle through the skin, there is a theoretical chance that some bacteria will come inside. So it's just important then with the communication of the patient to warn them what are the early signs of the infection, okay? The most common thing that we describe is that unfortunately they don't work in 100% of the cases. So this is the one thing. And the other thing with the knee and the hyaluronic acid is that there is a chance that you miss the joint. So you put the hyaluronic acid in the soft tissue, which can be quite painful for the patient. Even the highest experience of the surgeon does not guarantee in 100% that you are going to be inside the joint. So these are like, but it's very rare, less than 1%.
Yes, that's reassuring. That's great. I know many patients who tell me that we went to the doctor for the joint pain, wherever it is, and we were offered a choice: injection or surgery. I mean, how can the patient decide? And as an orthopedic surgeon yourself, why you give the choice for these patients for them to choose? Based on what?
So for the surgery, sometimes it's very easy, sometimes it's difficult. Why would I say this? Because if you have a mechanical problem, for example, inside the knee, that you have a tear of the meniscus grade 4 with a flap, no injection will help there. Okay, so it's zero possibility that it will help. Now, there is a little bit of gray zone in some conditions. For example, some of the orthopedic surgeons for calcific tendonitis, they will directly offer you surgery, okay, to go inside, find the calcium deposit, clean it, suture it, and that's it. Okay. Where there is like 100% chance that you will be okay. We can do in most of the cases the same thing with injection, but it's not 100%. Okay, so
that's why you offer them a choice.
Sometimes, yes.
With education about the results.
And you know, not every patient is willing to go for the surgery for some small.
It can be an option.
So you have, in some cases, not all cases, when there is a little bit of gray zone where there is a chance. So for you, maybe if I tell you that there is only 10% chance of healing with the injection, some patients will say, no, I don't want to do this. But some patients will say, look, even if it's 2%, I will rather try with injection so I have a peace of mind and I want to see if I'm going to recover without any surgery than to go to the surgery, okay?
Yes.
This is the right.
And so it's basically mainly the decision of the orthopedic surgeon on these patients, except in certain gray zones, let's say.
Yes, and the patients. So not all patients they want a surgery. Not all patients are comfortable with injection. It depends. It depends on the case to case basis.
Yes. Dr. Goran, what's your final message to the people when it comes to these injections and the new technologies now treating joint pains? What do you want to tell them?
So look, this is a good option. This is the good, I would say, not alternative, but this is one of the viable options in certain cases. It's not a magic. It's not panacea that it will solve all your problem. PRP is nothing else than your blood. So what is the PRP? These are the good proteins and good molecules which help with the healing in certain cases, not all cases. And this is a viable option. Don't be afraid to try it if you have a proper diagnosis and if you're treating orthopedic surgeon or your physician offers it. Try it and you see. There is a very minimal chance that it will go wrong, that you will have some complication, but there is a good chance that you will benefit from it. Okay.
Thank you very much, Dr. Goran Bicanic, for all this great information about injections when it comes to treatment of joint pain. And stay tuned for our coming session.